Hello everyone, this is Yoshiko Yamaguchi from Kwassui Women's University, Japan. Thank you for inviting me as a keynote speaker in this international conference. Today, I will present one of our research regarding a part of nurse retention. Our research is focusing on nurses. Nurses are predominant healthcare workers in the world and delegated to the robust role of maintaining or promoting people's health. So nurses are important occupation to keep people's health status. However, the number of nurses are insufficient in the world. Many countries are facing a serious situation of deficit number of nurses. Therefore, we want to explore effective way how nurses to keep in their workplace. Before leaving work, employees often feel intention to leave work, of course, not always. Therefore, numerous research have researched what factors are antecedent for nurses' intention to leave the profession or workplace. At first, as I show you, job satisfaction. Job satisfaction was likely most researched regarding as important variables of nurse turnover. If nurses dissatisfied to their work, nurses feel intention to leave work were reported on numerous research work in the world. Next is job tenure. Many nurses researchers pointed out that newly graduated nurses feel more intention to leave work than nurses who have long job tenure. One possible reason is that newly graduated nurses do not gain enough skill or knowledge working as a nurse. Therefore, new nurses feel more work-related stress than they perceive intention to leave work. And next is organizational commitment. This factor was especially related to nurses' intention to leave their organization rather than profession, nursing. If nurses do not like their organization or do not want to contribute to their organization, nurses feel intention to leave their work. And next is job control. Job control is a freedom for nurses on clinical practice. If nurses allow to decide their care by themselves or nurses can act what they want to do, nurses satisfy their nursing, then they intend to continue to work. Contrary, if nurses are restricted and rejected to their freedom of nursing care, their intention to leave work increase. And next, and last one is I show you. And next is supervisor or coworker support. If nurses feel their supervisor or coworker friendly or supportive, nurses feel comfortable their intention to leave work or decreased. These are not all reported antecedent of intention to work. However, most of these are work-related factors. Intention to leave work related to work factors are like obviously. Then is nurses' intention to leave work is only affected by work-related factors? In some, not so many previous research, it was reported that family factors related to nurses' intention to leave work, such as kinship responsibility, family needs, age of the youngest child. At first, family responsibility is that parenting, child-rearing, housework, and care for dependent family member, and so. And next, work-family interface, positive or negative perception between their work and family life. This is not an actual family task. It's a sort of perception of individual. On next slide, I will explain definition of this perception, which are work-family interface, positive or negative. Both work and family are our foundation and necessary things. Most of the time, other than sleeping time, we spend in work or with family. For us, work and family life affect each other. For example, when we failed something in work, then feel depressed. After go home, we feeling not good, then wouldn't want to do for family obligation. However, contrary, if we success dedicated project in work, we are very happy, then we can enjoy to do family task after go home. Also, opposite direction exists. When we spend happy time with family in a family, so we feel happy, then we can go to work, then we will be able to good perform in work more than we are normal feeling time. Regarding negative direction, representative concept is work-family conflict. Work-family conflict is perception of difficulty arise from competing responsibilities to work and family. Individuals who are active in both work and family domains experience conflict about the distribution of time and energy for performing each task, which is defined as work-family conflict. Therefore, this perception have negative effect to employees' psychological consequence variables turnover intention as well. On the other hand, positive direction representative concept is work-family enrichment. Work-family enrichment, which occurs when an individual task the resource created in one domain and transferred them to the other domain, creating a better environment in both domains. It seems like integrate both work and family life. Therefore, this perception have positive effect to employees' psychological consequence variables, well-being, good mental health status, and reduce turnover intention. In past study, negative side of work-family interface, concept of work-family conflict, as I told you, its antecedent or consequent was focused. However, recently, this positive perception work-family enrichment have been focused by researchers. Then these two work-family perception have opposite impact to work or family status. Negative perception, work-family conflict have negative impact. So if someone's work-family conflict high, then if it continue, he or her mental health impede or decide leaving work. On the other hand, positive perception, work-family enrichment have positive influence. If someone feel work-family enrichment, if it continue, he or her job or family satisfaction high, they feel happy in both domain. However, contrary to work-family conflict, which is negative perception, reported result related intention to leave work are inconsistent. Then we considered what is work. We work for what? The primary one would be gaining money for living independently. However, why we work? The reason is not only for money. We can perceive achievement, fun, pleasure throughout working. For example, if someone be grateful or their state was improved for work which we have done, we feel very happy because we are able to recognize we contribute for others by ourselves. Therefore, we suppose that if nurses love their work, nursing, feeling unfavorable nursing, motivate to work as nurse, they would try to continue to work while adjusting their work and family environment. Along the mentioning background, we generated the following study purpose. The purpose of this study is to clarify which factors have more impact to nurses' intention to leave their profession among their work engagement, work-family conflict, and work-family engagement. Data were collected in the Kyushu district of Japan. We randomly selected hospitals, nursing homes, and home health care institutions in Kyushu, then asked them to give the permission conducting this study. Finally, 4 hospitals, 20 nursing homes, and 34 home health care institutions have agreed to attend our study. And finally, we analyzed total 533 valid questionnaires. We measured target nurses' work engagement, work-family conflict, and work-family engagement as independent variables and their intention to leave the profession as outcomes. We applied regulation analysis to analyze the relation between independent variables, work engagement, work-family conflict, and work-family engagement, and dependent variables, target nurses' intention to leave their profession. This is the result. Both work engagement and work-family conflict, work interference with family, are associated to their intention to leave their profession. Work engagement was significantly negatively related to their intention to leave the profession. It means that if nurses feel more work engagement, they would perceive less intention to leave nursing. Contrary to work engagement, work-family conflict, work interference with family, not family interference with work, was significantly positively related to their intention to leave nursing. This means that if nurses feel more work-family conflict, they would consider leaving nursing. Different to work engagement and work-family conflict, work-family engagement was not significantly related to their intention to leave the profession. Work engagement showed the most magnitude of impact effect to their intention to leave nursing. In this regulation analysis, work engagement indicated about 4 times more T-score than the work-family conflict. Implication for practice. Ahead of it, this study have limitation, especially sampling. We conducted in one area of Kyushu in Japan, so this result might have contained characterized culture of Japan Kyushu district. From this study result, it is implied that if nurses love nursing, they feel bigger dedication and absorption for nursing, they may continue nursing with while adjust their work and family environment. This was simultaneously show if nurses who have less work engagement perceive work-family conflict, they will possibly feel more intention to leave nursing. Work engagement was the most effective for less nurses' intention to leave profession. It is shown that to make the job content of nurses more attractive for nurses would be effective for less their intention to leave nursing. In future research, what job content is attractive for nurses should be explored. This would important for nurse retention. Thank you for your kind attention. Thank you very much.